Welcome back to Mountain Connections. Mid-October marked the annual Medicare election period. So if you have Medicare, you have some important decisions to make. I recently spoke with Catherine Field from Humana all about this. Let's take a look.
People with Medicare need to make an important decision between October 15th and December 7th as they work to identify the best plan for their individual health needs. Selecting a Medicare Advantage or Medicare Prescription Drug Plan can seem overwhelming, especially as the COVID-19 pandemic continues, but there are a variety of resources available to help people research plan options. Joining us with advice on how to get started is Catherine Field, Senior Vice President and Medicare Division Leader of Humana. Catherine, thanks for being here today.
Thank you so much for having me.
If you don't mind, let's start from the beginning. For anyone that may be jumping into this for the first time, what's the difference between Original Medicare and Medicare Advantage?
You know, that is such a great question because they sound a lot alike, and there are similarities, but there are also some important differences. So Medicare, or Original Medicare, is the government-administered program that provides health benefits to those who are 65 and over and those folks that are disabled. This program provides benefits that cover hospital services as well as outpatient services, so all your doctor's visits. Now, Medicare Advantage plans are administered by private health insurance companies like Humana. These plans are required to offer everything that Original Medicare offers, but they do tend to offer a little more predictability and a little more benefit, and I'll tell you what that means. Medicare Advantage plans tend to offer predictable copays. They are all required to offer a maximum out-of-pocket protection, so you know over the course of the year what the max is you would spend on your healthcare coverage. And then it has all these extras that Original Medicare doesn't cover at all. So things like dental, vision, hearing, sometimes a gym membership. Oftentimes it includes the prescription drug plan as well. So people who are on Original Medicare would buy a separate standalone Part D prescription drug plan, whereas with Medicare Advantage, many of those plans are already include the Part D coverage. So those are a few of the basic differences between Original Medicare and Medicare Advantage plans.
There's an ocean of information out there. What should we keep in mind when it comes to choosing a Medicare Advantage plan?
Well, the exciting news is there's a lot of great plans. The difficult news is that when you have a lot more choices, it's hard to make a decision sometimes. So what I would recommend folks do is start with just a quick needs assessment before you start looking at plans. And what I mean by that is take the time to think about what do you spend your healthcare dollars on right now? And what do you think in the new year you will spend your healthcare dollars on? What's important to you? Is it prescriptions? Is it a surgery, etc.? The second thing to really consider is who are your doctors that are really important to you. You may have a specialist you've been seeing for some time or a primary care doctor that you want to make sure is in network for the plan you're considering. And then finally, thinking about all those extras, which ones really resonate with you? You may have been a hip surgery you need next year that you want to make sure has the right kind of coverage for you. You may have no longer be driving and you want to make sure there's a transportation benefit on your plan. So thinking about your spend, your doctors, and what are those extras that mean something to you. If you take the time to assess that up front, then start looking at the plans, it won't be quite as daunting.
And it can feel daunting. That's so true. Also, the cost of prescription drugs continues to be an issue, and some seniors have had to choose between food and medicine. What can people do now to ensure their meds and their doctors are in their plan?
Well, this is another area where it changes every year, and you're right, prescription drug coverage is super important, and certainly as we age, we have more medications that we take, and they change from year to year. So what we recommend is go to Medicare.gov. There is a tool where you can enter all your medications, and it will show you which plans will offer you the most value from a prescription perspective. So worth doing that every year. Most health insurance companies like Humana have a physician finder tool. So you can enter your physicians and see if they are in network. Now, both of those are really great resources, but sometimes they're hard to maneuver. And so that's probably my third recommendation is There are terrific licensed sales agents, health insurance agents. They're licensed and certified to sell Medicare Advantage plans. These folks are very, they use these tools all the time. They can also be very helpful to sort of maneuvering the sea of plans and helping you kind of maximize your out-of-pocket spend, whether it's on the drug side or on the medical side.
Beyond the basics, are there examples of innovative benefits that eligible individuals should look for?
Yeah, there is lots of activity with all the insurance carriers in terms of different types of plans and different types of benefit offerings. Three that we're particularly proud of at Humana that I just like to highlight quickly. One of those is the insulin savings program. We offered this on some limited plans last year. We've expanded it greatly this year. This is a program, speaking of, drug costs, insulin is very expensive. And so this program allows those who suffer, those who live with diabetes to be able to access insulin for $35 a month. So again, if you're somebody who's living with diabetes, you may want to look for a plan that has the insulin savings program on it. Another thing that we're particularly proud of is our plans. They're honor plans, and they're oriented toward those who are veterans and folks who have served our country. Now, certainly anybody can buy this plan, and a veteran can go to any plan they want, but this plan is uniquely designed for those who also use some of their benefits at the VA. And so you tend to have really robust dental benefits on these plans, as well as Part B give back. So, it means you get a few dollars back in your Social Security every month. So look for honor plans. They're terrific for everyone, but mostly oriented toward those who also have VA benefits. And then finally, we know that folks are using more virtual services than ever, particularly in this COVID pandemic time. And so all of our in 2022, all of our plans for virtual services will have $0 copays for primary care virtual services, urgent care virtual services, as well as outpatient behavioral health virtual care services. So more access to care from the comfort of your own home if you still are not feeling comfortable going back to accessing in-person care. So just a few things we're particularly interested or so proud of at Humana this year that are new from previous years.
And how can we get more information about everything we've talked about today?
So Medicare.gov, all day, every day is a great resource. Humana.com, another great online tool. And there, like I mentioned earlier, you can register to either get a virtual or telephonic or in-person meeting or a group seminar to learn more about Medicare Advantage in general, but specifically to help you pick a plan and get signed up for a plan, because December 7th is going to be here before we know it.
It absolutely will. Well, thank you so much, Catherine Field, for joining us today. Really appreciate this important information about all of the things with these different plans and helping us sort it out. So I appreciate your time today.
Oh, you're welcome. And thank you so much for having me.